we have a 27-year-old male that presents with nausea, vomiting, abdominal pain, which started 2 days ago, associated with increasingly blurry vision. Alright, so first let's attach a monitor, get an IV. Let's get a second IV. Blood pressure is a little bit low. Let's get some fluids. Alright, and then let's just ask the patient. Well, first, came with nausea and vomiting. Let's give some Zofran. I'll put caps lock on. Just so we can, communicate a little better. They're a little comfortable. So tell me what's going on. Been feeling really sick with a lot of stomach pain and throwing up. History. He's been feeling really weak, really thirsty, stomach. Okay, so thirsty is telling me it could be something like diabetes, and they've been using the bathroom more often. Okay, any medication, any history. Okay, I guess any history of diabetes. What about family history? Okay, how about night sweats? Okay. So I'm going towards diabetes. So let's just get a finger stick blood sugar. Let's get a ECG. All right. So blood glucose is definitely elevated. Let's do some normal blood work. Let's get basic Chem 7, CBC. Let's get lactate lipase. Let's get LFTs, magnesium phosphate. He's been throwing up a good amount. A urinalysis to check if there's any ketones in the urine. Because at this point I'm worried about like a diabetic ketoacidosis. Let's see. Serum ketones. That can check. I think that can help manage. You can like, how do you help like see how progressive the diabetic ketoacidosis is? I think. I'm not sure. And that should be good for now. Okay. So he's been throwing up. Makes sense why the electrolytes are all over. So potassium's low. Give him potassium. Glucose is obviously high. White blood cells are elevated, but that's because he's probably been throwing up a lot. Expect lactate to be elevated. Phosphate. Magnesium. Okay. Let's get an arterial blood gas. Okay, pH 7.14. Pico's 28. Okay. Alright. Well, let's give him some magnesium. And let's give him some potassium. Magnesium. Potassium. Alright. Let's do some examinations. Let's check his breathing, circulation, cardiovascular, pulmonary, abdominal, back flank, musculoskeletal, neurologic. I think you check his neurologic because he had blurry vision. I think he still has blurry vision, does not? Still. My vision has been a bit blurry, but the doctor gave me something that's helping with my other symptoms. Oh, he's talking about the Zofran. Alright, so I think the lead thing is some diabetic ketoacidosis. Let me check the urine. I don't think I checked the urine. You positive for ketones, glucose. There's some blood, protein. Okay, okay. So that just makes me more confident. Diabetic ketoacidosis. Let's give him some insulin then. An insulin drip. Yeah, let's just check if it's. Where is it? Investigate. Okay, so the blood sugar is definitely lowering. Now, is there anything else I should do? Fluids. I think it's good on one. I don't think I have to do a fluid infusion. I mean, I could. You know what? Let's just keep him on it, I guess. See, that's what I really get confused about. When to just give fluids, like just give like 1 liter and then one to get him an infusion. But other than that, I think he should be good. I'm pretty sure he has to go to ICU. And then this. Anything else? Investigate. Intervene. I think I gave him. So I gave him the insulin. Manage his magnesium and potassium. All right. Let's just hand him off and see what happens. 100%. All right. Well, I was not expecting that actually, but I'm actually really happy I got that. So diabetic ketoacidosis was a diagnosis. DKA. I saw this in the emergency room maybe once or twice, and that's kind of just what I remembered that the physician gave him and the steps they took. And so here is the explanation. If you would like to pause, it is untreated new type 1 diabetes. Makes sense, right? He had no family history, and so it just kind of developed. After discussion in this case with the endocrinologist, the patient should be admitted to the ICU. Potassium should be kept above 3.3. Okay. Yeah. So I hope you all enjoyed the 4th episode, and I'm really happy I actually got 100 on that one, just because I've seen like cases like this in real life. And so this will be the 4th episode. I'm glad you all are enjoying. I hope you are enjoying, and if you have any recommendations, please put in the comments down below. And this has been Shavan Patel, and I'll see you all next time. Thank you.